Hi, I'm Executive Editor Mike Moran, and we're here today with Don Spence, the CEO of Philips Respironics, and we're going to talk about the impact that Philips will have on the market, being a giant consumer electronics company. It's interesting. There's really never been a marriage of like that so far, and what does the future kind of bode for that, Don?
Well, Mike, first of all, I've been in my role as CEO of what's actually called Philips Home Healthcare Solutions, and it includes what was the Respironics business, but also includes a broader home care portfolio that Philips had prior to purchasing Respironics. And so, we're clearly very interested in telling as many people as possible the importance of care in the home. And we believe, our vision is about creating, along with our provider customers, a transformation where care in the home is part of the solution rather than often positioned as maybe part of the problem.
Right.
There's great opportunity to reduce cost if people can be kept out of the hospital in their homes. Now, some of the areas that I think Philips in the last years, as I've taken on this broader role, where we've tried to start focusing that attention. First of all, if you think about sleep, we've actually have what now we call within Philips, a broad integrated sleep that will not just be involved with sleep disordered breathing, where that has been the tradition of Respironics, but can we get into a broader set of sleep disorders that might include everything from circadian rhythm issues to insomnia. The use of light, obviously Philips has a strong position there. So one of the things we're trying to do is promote the importance of sleep hygiene, what will happen if sleep disordered breathing is not managed properly, the comorbidities. And so, our platform as Respironics was always about continuing to stress the importance and awareness of sleep apnea. I would say Philips not only wants to continue that, but broaden that to a broader set of sleep disorders.
Still clinical?
Still very much, yes. Yeah. Now, there's always the opportunity, some solutions, outside sleep apnea could involve, like our light therapy, is being supported through the consumer electronics side of Philips, what we call the consumer lifestyle side of Philips. But I believe what we're looking for are clinically validated products, right. And not gadgets. Something that can absolutely, in a very clinically meaningful way, help patients improve their sleep hygiene.
I'm curious, company cultures. Philips probably has one, Respironics had one, bring them together. I'm wondering, has Philips been are they throwing ideas at you all the time? Because everybody thinks about sleep. I mean, I would think, it might be kind of interesting.
Well, it is. I mean, it is a big company without question, but Philips has always been an innovator and a very strong technology innovator. And they have very, very extensive research capabilities. So one of the things I think has been good about the relationship is, number one, is they haven't tried to tell us how to run our business. Right. And in the business that we know, which is what has traditionally been the Respironics business, and they've allowed our management team to continue to focus on that, realizing we're the experts. At the same time, as we look at other areas to potentially grow in, for example, this broader sleep arena, there we do have tremendous opportunity to leverage the deep insight and technology, everything from their extensive industrial design capabilities to some of their pure research facilities. So we're actually quite excited how the two come to one. And also just realize, Mike, it's not just about sleep. Right. We have a very large respiratory business, and also the Philips organization prior to the acquisition of Respironics had what they call home monitoring, which includes the Philips Lifeline business. I'm responsible for that as well, and there it's really the focus on normally the frail and elderly. Right. And more as we look at an aging society with increasing chronic disease, the common message for all of us, whether you're a home care provider, whether you're an equipment manufacturer, as we are, whether you're involved in the actual care in terms of physician, or your home care services organization, how do we get this message out that keeping people in their homes, it's more recently it's a term aging in place has been used. And I think it's a great use of words to describe what we're really trying to do. Allow people to stay in their homes. Right. The Lifeline product line is a tremendous help to elderly. You know, it gives them confidence if they have a fall, they can get help right away. And there's a variety of things, everything from medicine compliance to ultimately just ensuring their environment is proper. So we believe there's this message that we're going to try to help send, not only on the behalf of Philips, but also really on the behalf of the industry. The importance of care in the home and people in their home is something that we're trying to say all the time.
Are there Philips, with, like you said, lots of research? Is Philips investing in Respironics directly to boost your research and development, or do you sort of work independently?
No, we don't work independently. More and more, I would say in the first 6 months, it took a while to get connected. But we try to establish what we believe are our strategic platforms and where we want to head. And then as we pull in resources from Philips, they work alongside our teams, sometimes independently, but with a common view of what we wanted to get done.
Right.
So, it's all directed, and it's directed in a positive way towards our vision and mission.
They must be in a consumer company, and as the HME industry moves more towards the consumer, that must be a nice area of resources that they can help with. Reaching out to the consumer.
Yes, but one thing I want to point out, that Philips isn't just a consumer company. There's really three pieces of Philips, and all of them have a common view of what we call health and well-being. Consumer Lifestyles is the typical company that people may know from Philips, with everything from flat screen TVs to the Sonicare toothbrush, which is very important product. Our lighting business primarily sells, does sell also to consumers, but also does a lot of sales to other, everything from architects and to builders, and utilizing light in a positive way. And then the healthcare business is a sizable part of Philips. And Philips' experience in healthcare dates back to the early 1900s with the innovation of the X-ray, and they have a long history in healthcare. And traditionally, we've been more associated with the hospital side of the business. And now, especially with the demographics and really the aging and chronic diseases that we're seeing, not only in the U.S., but around the world, we believe home care is an important part. And the other part of that is, how do you ensure there's a connection between what happens in the home and what happens in the hospital?
Right.
They can't be isolated.
Right.
So again, those messages are ones that we're trying to send, not only to demonstrate our commitment, but also, I believe, it also is a similar message that we want to send for the industry as a whole. That home care matters, is critically important to controlling costs, and it's the right thing to do for those who want to stay in their homes and don't want to end up in alternative care settings, and they want a good, healthy, and active lifestyle.
That's right. All right. Well, Don, that's great. I appreciate it.
Not at all. Thank you for your time, Mike.
My pleasure. Bye-bye.
Okay.